Can we go to hospital, doc? There is a challenge where people are saying, if you are sick and you go to hospital, people are dying in hospital. Or if you are diagnosed, you go to hospital, people are dying at hospital, stay at home. What do you say, doc?
So our statements have to be backed by numbers. And unfortunately, if you look at the numbers of people who are dying at home currently with COVID-19 and those who are dying in hospital, the number of people dying at home in Harare and in other parts of Mashonaland and in Bulawayo, they're higher than the number of people who are actually dying in hospital, which means people are dying at home. So it's really important to understand that hospital is the place for sick people. Especially when you have COVID, what you need is to be monitored regularly in terms of whether you need oxygen, what your temperature is doing, and so on and so on. Now, what happens when you have COVID and your doctors or your practitioners have diagnosed that you have COVID? The first thing that they do is they assess the severity of the disease. They classify the severity of disease and they say, you know what, you've got asymptomatic disease, or you've got mild disease, you've got moderate disease, or you've got severe disease. If you have asymptomatic disease, you definitely will be managed at home isolation. If you've got mild disease, you would definitely be managed at home. You do isolation at home unless the conditions at home are not suitable for isolation. If you've got moderate disease, the doctors will assess and say, okay, these moderate symptoms, are they manageable at home or you need to be in hospital? If you've got severe disease, you need oxygen, you need medicines, you need, drips and other things, you obviously need to be in hospital. If you've got critical disease, then you need to be in the intensive care unit. So one reason why you should have a medical assessment is that the doctors or the medical practitioners must tell you the severity of the disease, and then they can advise you properly in terms of where you should be, either home, isolation center, or hospital. There's a phenomenon that's killing a lot of our people now, not just in Zimbabwe, but elsewhere around the world. It's called silent hypoxia. Hypoxia is when the oxygen concentration in your blood falls and then you are not able to supply your essential organs with the right amount of oxygen that they need. And this is one of the biggest problems in COVID because it's a respiratory problem. So silent hypoxia or happy hypoxia means that the oxygen levels in your blood, you're fallen down, but you are continuing with your normal activities. And by the time that you're discovered to be hypoxic, your oxygen levels have really gone to a very critical level and you may not be able to come out of it. So this is part of the reason why you need to be in constant touch with your doctors, not necessarily for admission, but just to assess you on a regular basis, whether you can continue with treatment at home or whether you need to go to a facility. So yes, we should go to hospital, we should be assessed, and if it's important to go to hospital, then let's go to hospital. But if our practitioners have assessed and said we are suitable for home isolation, then let's do so. So the point is, the decision to stay at home should never be made by a person alone, but this should be made in consultation with medical practitioners so that you are told of the best place for you to be.
Now, there's an issue, a question that has been asked about taking care of children, where maybe one of the parents or both parents are diagnosed, but the children are not. And in some places, they say the children, they should be monitored before. They don't necessarily need to get tested, but if they start showing symptoms, then get tested. If, say, parents are diagnosed, is it encouraged for them to still mix with their children or not? And is it encouraged to say they should get the children tested or not? And also, if it's not safe to do so, how can they take care of their families in this environment where it's usually not that easy to get other people to take care of the children?
That's an important question, actually. And part of what's supposed to be happening when somebody has been diagnosed of COVID-19 is a process called contact listing and contact tracing, which is an essential part of what we call surveillance. So surveillance is one of the most important aspects in terms of the control of COVID-19 in a country. And one of the things that is supposed to be done is to go and assess these children at home, because most of the times they actually then contact and say, how are they doing? Clinically, are they okay? Do they seem to be having any problems? If they seem to be having problems, then definitely they need to be tested. Then the next thing that we do is we assess. This is where we assess and say, okay, there are 5 kids here and their parents who have COVID-19. Is this a suitable environment for isolating the parents, or we have to take them to an isolation center? These are some of the things that we look at. And so what do we look at? We look at whether they have enough rooms, they have enough amenities to be able to then separate, the infected from the non-infected. And this is what we call isolation for the infected and then quarantine for the contacts. So isolation needs to happen where there is adequate space, that the infected person has adequate room for themselves. Ideally, they should even have, separate ablution facilities for themselves, and, they feed from their room. Unfortunately, our environment is not always conducive or permissive to that, and therefore we have to make decisions together as the healthcare providers and then as the parents to say how's the best way of going about this. The most important things, of course, is to always then be maintaining a physical distance from those children if you're living in the same house, to make sure that you are always putting on your face mask, and then if there are kids of a certain age who can put on a face mask, because in general we don't encourage very young kids like those below 2 years to be putting on face masks. But if they are older children who can put on masks, then it's advisable that they also be putting on their face masks. It's then important to make sure that we maintain adequate personal hygiene ourselves as the ones who have been diagnosed of the COVID-19, and then our kids, making sure that we observe all the infection prevention and control measures that we're talking about in this environment. We avoid then eating with the kids from the same plate, which is the tendency that sometimes happens at home, especially in our context. You want to eat with your kids, and then as you're doing so, you're sharing utensils, you're sharing plates and cups. This is what you want to avoid, because then you just increase the risk of getting the kids infected. So it's important that you work together with your team that comes to assess you at home to say, is your home suitable, and how best can you turn your home to be suitable for isolation at home to protect the kids as well.
Yeah. Now, a lot of us, Doc, whilst we are there on separation, isolation, quarantine, majority of us, we stay in places where we share bathrooms or ablution facilities. Now, if one person is diagnosed, what do you recommend? Is there a way that we should follow in cleaning up the ablutions? If someone, there's, obviously the toilet, there's the bathroom or the shower. Is there a specific way that we should look at cleaning, or should we rather say the person who's in isolation, we have to find a means and a way for them not still to use the same ablution, which might be difficult? How do you recommend we deal with this?
So, we have to look at our socio-economic circumstances, and they are unique for every family. So we cannot recommend something that's umbrella. But I think the important message is, if you're sharing facilities because you have no other way of doing it, maintaining extreme hygiene is what becomes important. Once you're finished using these facilities, you need to then wash them straight away with soap, and you must have lots of water, running water available for you to use. If you've got any alcohol-based sanitizers, they are also good just for cleaning surfaces. In the past, people were disinfecting homes and so on. This is quite expensive and maybe not really necessary. So it's an issue of just being precautious and maintaining as much hygiene as possible, because sometimes we have to be realistic and look at the context. In our context, sometimes it can be very difficult to separate and talk about the textbook things that we talk about. So we have to look at each home as an individual homestead and see what works best for them. But at all times, I think we cannot overemphasize the need to be hygienic and cleaning with whatever we have. And liquid soap, the ordinary sunlight is very good for doing that with lots and lots of water. That's essentially the point. Whatever you do, you also then need to do that with lots of water, preferably running water if you have.
If you have. Great, great. Now, I just want us to turn now maybe to exactly where you are, Doc. You are practicing in Zimbabwe. Can you just bring us to abreast what's the situation in Zimbabwe in terms of COVID-19 in the hospitals? What is it looking like in terms of people coming? How much people, forms of treatment? How long is it even taking for people, to get tested or get their results? What's the general overview situation in Zimbabwe?
So yes, when we're answering that question, we have to remember that COVID-19 is a disease of national importance, and its treatment and control prevention is under the mandate of the Ministry of Health and Child Care. We also have to look at the fact that we have a rising case burden in Zimbabwe. We've just confirmed over 30,000 cases, and the active number of cases about 9,000. And we know that we have about 200 people to 300 people at the moment who have disease that requires hospitalization and housed in various hospitals in the country. Now, what the government did or tried to do was to make sure that in every district and province, there are centers that are designated as isolation centers. So if you go to any province and ask for a list of isolation centers, you will get them. So isolation centers are available. Pertinent Hospital also has a wing that has been turned into a COVID-19 unit, which can house a number of patients. So there are beds available for admission for patients there. And of course, there are lots of private facilities scattered around the country which charge various amounts. I think in terms of places for admission, that's not a problem. What seems to be a problem, as far as we understand and as far as we are told, are the resources to use, which include human resources, that's the nurses and the doctors, and then the medicines, the oxygen, they are running in short supply. Sometimes there are shortages of personal protective equipment around the hospitals. That's called PPE. So, of course, the government and its partners who it works with, the non-governmental organizations, have tried as much as possible to source personal protective equipment for workers in various hospitals, but this can never be enough. So obviously there are shortages, there are stock ruptures from time to time, and this is where the problem comes. So people should not hesitate to go to hospitals because these facilities are there, but they should know that sometimes there are resource challenges, and they may be asked to buy certain medicines for themselves. I think this is something that's always been happening even before this COVID-19 came, because we've got economic challenges. Yeah, but so I've seen reports where the situation seems to be over-exaggerated. I've seen reports of dead bodies everywhere. That doesn't represent a true situation, of course, but that is not to say that we are not without our own challenges.
Okay. And in general, in terms of testing that you are having in Zim right now, is it a rapid testing? How long, results if one gets tested?
Okay, that's fine. That's important. We have two types of testing, and they are both available in the public sector and private sector. We do the conventional PCR, which is what we've known, which is expensive. It's costing about $50 to $60, especially if it's done in private and most people cannot afford. If patients are hospitalized, then this is usually done for free, even around the various provinces of the country. This can also be done on a platform that's called the GeneXpert platform that was originally designed to test for TB. So that platform is also being used to test for COVID. The problem with that is it needs a special cartridge, and the cartridges are imported and they are in shortage globally. They are in short supply in the global market. Now we have adopted the rapid antigen test. This is very important. The first rapid test which was done for COVID-19 was called the rapid antibody test. we essentially threw that in the bin because it's very useless and it's not useful for treating and managing patients with COVID-19. Now, the rapid antigen test is a good test and it's been adopted into national policy. It picks COVID-19 with as much or close to conventional PCR specificity and sensitivity. So this is a test that can replace PCR. And it's cheap. It costs about $15 to $20 as compared to the $50 to $75 for the conventional PCR. It doesn't need special laboratories, which means even in the various parts of the country, laboratory scientists have been trained to conduct this testing, even in facilities at district level, which is the major advantage because the usual turnaround for the conventional PCR was very long. It was going to up as much as 7 days in some instances, and that would really be useless in terms of controlling a pandemic. But with this rapid antigen, you can be assured that you get your results on the same day as the test. It takes it takes minutes to get the results from this. So all people who are being tested through the rapid antigen test actually get the results on the same day. So this is something that we hope and expect that it will improve the turnaround time for the results and should help in terms of control.
Wow, great. Doc, we really do appreciate. I've got one additional question that someone sent me, but that came a bit later. And I'll edit it and put it in front earlier. Now, for people who are tested positive, but they don't have any symptoms yet, this happens usually because maybe one person in the family tested positive, or maybe, one is a close contact, then they go and get tested, they're tested as positive, they've got no symptoms whatsoever, nothing has changed with their life, everything seems to be normal. Are they also supposed to start seeing a doctor? Number one. And number two, should they expect that it's possible that symptoms will come up later, or they can go through the whole period without ever having any of the symptoms? And last question is, for people who have tested positive or have had the disease, what are the chances of having a reinfection?
Two great questions, actually. So the first question is, if I am asymptomatic, I've been tested because of contact tracing or some other reason, and I'm found to be positive, do I need to see a doctor? Well, in terms of the public health system, the people who actually test you are healthcare professionals themselves. So they monitor you for temperature, for cough and other things regularly. And if you've got any problems, they will alert you that you now need to see a doctor. Usually after 10 days, if you have no problems, we actually then de-isolate you and we consider you recovered and we report you as a recovery, in which case you don't need any further follow-up and unless you really develop any other problems. And this is very common. A lot of people who are tested through contact tracing are actually symptomatic and never develop any problems and then don't need to see a doctor. Okay, then the second question is, in terms of do I get reinfected if I've had COVID-19 before? This is kind of a very unclear sort of question at the moment. I think the evidence on the ground suggests that you can actually be reinfected, especially if you've had mild disease or if you had asymptomatic disease. You can be infected because your immune system really didn't just build up a very great response the first time. But the ones who develop critical disease or severe disease might have less chances of being reinfected. But this is a continuous sort of research question that we continuously look at so that we can have definitive answers to this, because this is also going to help us in terms of the vaccination programs, that we're talking about, to say if somebody has had COVID-19, then do we really need to vaccinate them, or we can assume that the natural infection they acquired gave them, good enough immunity. So this is a process that will continue to be refined as time goes on, and I'm sure we have definitive answers.
And I know, Doc, because you just dropped off that one in our previous interview with Dr. Rasala Navo, who's based in South Africa, Limpopo, we spoke a bit about, vaccines and stuff. And in this specific interview, we tried to not spend too much time on that. But I think it does not hurt, because these conspiracy theories just continue to grow bigger and bigger by the day, become more and more complicated. But in the shortest possible way, Doc, vaccines. Overall general view from yourself. When vaccines arrive in Zimbabwe, in Africa, in different parts of the world, recommendation: should people take them? Should people take them with caution? Should people look at maybe if they've had other medical issues before, use that to decide whether or not to take them? Or should this just be an issue of discretion?
Wow, very, very good question. And of course, again, I have to give my own personal views. And the thing is, I'm a public health practitioner, and I am a beneficiary of vaccines over the years. Yeah, I've been vaccinated several times, even including against H1N1 and so on. I've received several vaccines, and they are all quite safe and effective. And I have reviewed the evidence or the data for the use of the current COVID-19 vaccines. And we do have to realize that we have different types of COVID-19 vaccines that have come on the market or are coming on the market, which include the Pfizer vaccine, Moderna, the Zeneca, the Sputnik, and so on. There are about 5 now. And they are all based on different mechanisms in terms of how they actually boost the immune system or stimulate the immune system to produce an immune response. For the ones that have completed their trials, like the Pfizer, like the Zeneca and the Moderna, which have undergone, rigorous clinical trials, phase 1, phase 2, phase 3, with a very huge number of participants, over 70,000, participants, which is phenomenal. It's great, but it's been enabled by the great speed of replication or multiplication of COVID-19 cases. It has enabled us to have such a huge sample size over a very short period of time. And of course, modern science has brought a lot of efficiency, which has enabled us to shorten processes that could potentially have taken years. I think the safety profiles of the vaccines in the short term, we have to emphasize in the short term. We can't talk about the long term because COVID-19 has been around for just around a year. So we can't talk about 15 years or 20 years. Time will tell. Like with all the other medicines, when you have used them for 20 years or 30 years, that's only when you can know the long-term safety profile. But based on what we know and what we've seen so far, these vaccines are quite safe. They are very effective. Their effectiveness goes up to 95%. When it comes to Zim, I'll be the first one to take a SARS-CoV-2 vaccine, and I'll probably love to go on TV, actually, just to show the world that I've also taken mine, because we need to do so. Why do we need vaccines? Because we know that they are the best intervention for us in terms of reducing the morbidity and mortality. This is important. They don't prevent infection, but they reduce the severity of the infection by and large, and they reduce the deaths, which is the mortality. Vaccines have been the greatest intervention in public health in terms of reducing the morbidity and mortality associated with infectious diseases. And we expect the SARS-CoV-2 vaccines to actually do the same. The thing that we don't have with SARS-CoV-2 is time. With COVID-19, we don't have time. 99 million infections in a space of 1 year, about 2 million deaths so far in a space of 1 year. That's really massive. And if we let it continue like this, how many more people are going to be infected over a year, and how many are we going to lose? So I think, we really need to move in fast with vaccination, particularly for the vulnerable and also for the healthcare workers, because when we protect healthcare workers, we protect a huge proportion of our population. So we really need to move in fast into those groups, and then we can go on to the general population. But what's important to emphasize is that vaccines are never forced on anybody. So I think when they come, if you're not interested in taking the vaccine, it's okay. Do not take it, but do not discourage others who know the benefits of vaccines, because they are good for our population and they should be encouraged.
Wow, great. Any timeline, do you know, within Zimbabwe? Do you have an idea, or you don't know? Timeline of vaccines?
Okay, so what we know is lots of arrangements are being tried to make the vaccines come into Africa, because as you know, so far, no African country has received a single vaccine, whereas 60 million people have already been vaccinated in other parts of the world. So Africa is lagging behind. The president made a speech yesterday as he was doing a State of the Nation address, and he said vaccines may be available in 2 to 3 months. The Africa CDC, which is working on acquiring vaccines for the African continent, has also said there is a possibility that we might acquire these vaccines into Africa in the next 3 to 6 months. However, these timelines, for now, we can actually not say them with certainty until we have something solid written, but we hope that they will be available soon for everybody.
Thank you so much, Doc. We cannot express our gratitude enough. We have really been seeing the growth of the disease, and we are trying as Baobab Chats to do the bit that we can in terms of awareness, just to bring information. And what we will be doing is, this broadcast will stream it via our Facebook, Twitter, we'll stream it via our YouTube. We will also be doing extracting the voice notes of it, try and compress it to as smaller size as possible, distribute it via the likes of WhatsApp and all, because what we just want to do is to try and conscientize. We say one life saved is one enough. That is worth it to spend days and hours on it. And you've taken so much of your precious time to come and spend this time with us. And we hope we'll be able to have you some time for a live Q&A, if possible. That would help us so much. Do you have any parting message or comment that you'd like to share with the people?
Sure. Thank you so much. I think what we need to just remember and keep emphasizing is that we need to do all that we can to protect ourselves, our families, our loved ones. So let's work together to actually prevent the further spread of this disease. And, as our governments continue to fight, let's also be helping them by doing what we can. Okay, thank you.
Thank you so much, Doc. This has been great.